Now, Coltine makes a product that has, it's different, but it has a similar goal, and that's the Componeers. And how did the Uveneers compare with the Componeers?
Well, the problem with the prefabricated veneers, which the Componeers are, is that you have to size them perfectly. And not all the Componeers fit the teeth well. And when you add to them, or when you modify them, you see the lines where you have to modify them. With the Uveneer, you could use any type of composite that you want, so there are no lines, and basically it's a seamless transition. It's a very easy product to use.
So is there any other product on the market that's a template like this Uveneer product?
No, there are no other templates. There's Componeers from Coltine, and there's Edelweiss from Ultradent, but both of those are pre-finished veneers, and they're far more costly and far more difficult to use.
Okay, Dr. Friedman, are the shapes varied enough?
Yes, the shapes fit into most patients' mouths. They're generic in the sense that they don't fit everybody exactly, but they don't have to, because you use your underlying composite, flowable composite, to fill in the space between what exists and what you'd like it to be. The shapes are varied enough, and the sizes are varied enough. I've never had a problem with the creation of the aesthetics of any anterior tooth with the Uveneer system.
Okay. And Dr. Ringer, what do you feel are the benefits for the dentist and for the patients of this product?
Well, it's such a time-saving procedure that it's obviously beneficial to the dentist. Less chair time, less costs. Can pass the savings on to the patient. The patient is sitting in the chair less, so it's more comfortable for them, and it's very efficient.
Okay. And then let's address two different types of practices. Let's take a practice that, say, provides sophisticated aesthetic services. Do you feel like the Uveneer is appropriate for that type of a practice?
Yeah, it definitely has its place, particularly in helping to design the sophisticated case, creating like a template for the patient to get an idea before you move on to the more definitive ceramic work, for argument's sake. And even for those dentists who are doing sophisticated composite therapy on the patient, the Uveneer system can be a very good foundation, which can be cut back, layered in order to, and then to create the final optics, the sophisticated optics. So there's definitely a place in a high-end, if you want to call it, sophisticated practice.
Okay. And Dr. Mechanic, what about for a dentist who provides very basic aesthetic services?
I think it's the ideal thing for a general dentist just getting into aesthetics. A lot of them are afraid to do composite bonding. And the Uveneer system is like training wheels. It gives them the form, it gives them the shape of the tooth, and it's a great start for them to learn all about aesthetics and to give a patient, you know, a restoration that the patient's going to be happy with. And gradually they improve and learn to customize, and they become master aesthetic dentists. It's a great thing.
Okay, so in summary, is this a product you recommend then, the Uveneer?
You can't lose with it. It's simple. It's simple. It's good at all ends.
Okay, what about you, Dr. Friedman? What would you say?
It makes the practice of anterior aesthetic dentistry easier, faster, and better. Yes, I recommend it.
Okay, and Dr. Ringer?
Oh yeah, definitely. I mean, the cost of it is made up almost instantaneously just in the chair time and the satisfaction that you're going to be able to have from creating these works so efficiently. So I would definitely recommend it.